Welcome back to the Catalyst Pharmacy podcast. We had Rannon Ching on with Tarrytown Pharmacy. Talked about a lot of cool stuff he's either thinking about or doing. Obviously, they're looking and leaning into LTC and their pharmacy, obviously getting ready for flu season and all of that stuff. But also he spends a ton of time on like medical billing and the services that they're able to bill for either in Texas or with in partnerships with providers, and some of those relationships with like remote patient monitoring and how he's kind of doing that at some scale. And then just some of the cool success stories they had with that. So we'll take you there now. Thanks. Really what I wanted to get into with you and all of this is, one, let's catch up. Let's get everybody like kind of caught back up. Everyone knows you already, but if you don't know Rannon, where have you been? But what are you? How's I guess like what are you guys doing in the four walls of your pharmacy working on this year? We'll catch people up a little bit too. You guys are Tarrytown Pharmacy in Austin, Texas. Single location, but man, you guys do, I swear, everything out of that location. Can you guys give us a little bit of a overview of the breadth of services you guys are rolling in there?
Yeah, for sure. So yeah, like you said, appreciate your intro, Mark. And yeah, we're Tarrytown Pharmacy. We're here in Austin, Texas. We've been in business since 1941, so pretty much over 83 years, or almost 84 in December. But yeah, we've been having a lot of stuff going on. And so I think the biggest thing that we're really in the midst of right now is like the vaccination season. And so like everybody, we're doing a lot of flu, a lot of COVID. We've got, clinics lined up, for the next, 2 months. And so we're really heavy into that. One of the bigger things that we're doing as well is we already have actually like a separate a sister long-term care pharmacy called Expo Care that nationwide, and they take care of folks specifically with intellectual and developmental disabilities. But we've always also had in our flagship store here, we've had long-term care for your traditional nursing, memory care, and assisted living.
Oh, okay.
Yeah, and one of the big things we're doing now is we're actually expanding that. So we're working on getting even a separate pharmacy license, expanding that. We are utilizing, technology to integrate with the nursing homes and the communities, like EMR system as well. So we're really working on trying to grow and expand that. And we've actually just signed on a new community that's going to come on board in a few months, and another one coming on next year. So we're,
congrats.
we've kind of done the LTC side on a large scale with IDD, but now we're kind of like growing our our homegrown here in Austin and kind of Texas traditional LTC as well. So that's been a lot of fun.
All right. Let's stay on that a little bit. What's that been like as far as, I'll just say, sales, business development? I mean, you guys, I would think everyone knows Tarrytown, at least around in Austin for the most part, if you're in the, healthcare space in general, or has it been a little bit of introducing who you actually are and some of that, or a blend of both?
Yeah, that's a great question. And actually, that's something that I always just assumed that, we've been in the Austin area for so long that, sometimes I take for granted that people know us. And, like I have a letter on my desk today that was saying that, I used to go get sodas from the original location 60 years ago and stuff. And so there's a lot of people that know us. But what I think is most fascinating is that as we're talking to these director of assisted livings, who are kind of like the decision makers, even more so than the executive directors of these communities, most of them are moving from out of state. So the new community that we brought on, they were from California. And so they just moved here a year or two ago. So she, basically said, yeah, I've heard of Tarrytown, but I'm not super familiar with you. And then we have a new community that we're going to bring on in April. And the same thing, one of them's from Arizona, the other one's from out of state. So the great thing about Austin is that it's growing and there's new people moving here.
That's true.
But what I found, and actually that's kind of exciting to me, because that means there's more and more opportunity for us to get our brand out there, where I might think that, hey, we've been here for a long time. People might know us, people may not. So it's been actually refreshing kind of thinking that there's a new group of people that we can market to that may not know us or may not know our brand, but still nice to be able to rely on those kind of brand relationships that we've built over the years. So.
Yeah. Yeah, I was going to say, like, I forget about that, about Austin, in the sense of like how many new transplants y'all have had, like from California, really from everywhere. But I'm reminded when I try to drive through it,
Yeah, that's right.
I am reminded how many new people live there now.
Yeah, I feel like we're reminded every day too. We're like, how long does it get to go? Like 4 miles to the east.
But no, that makes sense. Like that's a different, like I guess just kind of a refresh of hey, look, just don't assume everyone, especially down there, as many people who've transplanted, just don't assume they know exactly what we're doing or how we're doing it. And that's cool. You get to kind of like restate what makes you guys different. What's some of that messaging with them, with some of that, like just the other pharmacies probably have their own, I guess, I don't know if struggles, but like have their own marketing and branding pushes too. How are you guys are kind of differentiating with that?
I think, to be honest, the biggest one that we differentiate ourselves with is just our website, but then also even just our Google reviews. I know I've talked a lot about, just online presence. And so if you Google Austin Pharmacy, like I think Tarrytown's number like 4 on the Google search list.
Okay.
A lot of by design. And so I think we did a really good job of amassing a really large email listing. So I think I have 30,000 people on our mailing list, but only about half of them are engaged. And so we have about like 16,000 people that read, every one of our email blasts. And a lot of times we'll have a call to action on there, but anytime I have a call to action, it directs to my website, which automatically increases organic traffic, which then bumps you up on Google.
Yeah.
And so one thing that's been really nice is when people just Google, Austin Pharmacy or vaccine clinics or flu shot Austin, or even just something like long-term care, long-term care pharmacy or nursing home pharmacy, that pops up. And what I found is I always get jealous of like pizza joints, because like they have, this new pizza place opened up like a month ago. They already have like 1,000 reviews. And then, there's pharmacies that have been in business for 100 years that have like 15.
Right.
Yeah. So
yeah, that makes a lot of sense. That's a good strategy, man. Kind of the mailing list is interesting. How long y'all been doing that?
Since COVID, actually, what I kind of realized early on, and especially when people were wanting to get on a wait list, I had to pivot because it was too hard to track. So instead I said, hey, we don't have a wait list, but go ahead and jump on our mailing list. And then that way, that's going to be the best way for you to get a hold of people. So I think at the height of our mailing list, I think I had like 45,000 people on it.
Holy smokes.
Which was insane. And I think our open rate back then was like 90%.
Oh, it had to be crazy high back then.
Yeah. Which it's a lot lower now. But it was funny because I was doing some research with one of my management students from UT. And I said, hey, what's a normal open rate? I think it's like 25%.
Yeah, if you can get above 20, it's pretty good, actually, from what I know. I'm not saying I know any of that stuff that well, but from what I know, if you can get above 20, that's pretty good. 50% is world-class for sure.
Oh, for sure. And that's what I'm thinking, too, is like I'm actually going to send out some new responses for like a re-engagement. So if people don't want to be on my email list anymore, I'll just kind of clean it up and keep the people that are really engaged. But that's been really helpful. And then also just, again, making it easy for people to leave reviews, because we had so many people just say, oh, I love your store. Or, I have friends all over that like, oh, I love using your pharmacy. But, I love hearing that. But when you post it online, it, again, generates a lot of traction for people to help find your store. So that's something that we do at the end of every vaccine booking or, rapid test. It automatically sends an email like a day later, just thanking them for using a small business. And hey, it would really help us if you leave a review. And so, kind of during the flu shot, COVID shot time, we get a lot of reviews, and they kind of trickle in throughout the year. But, I think we're over like 730 Google reviews now.
Oh, wow.
And it's kind of like, during the flu season, we're getting, 5 to 10 to 15 reviews like a week. So that's kind of the big thing that I always try to recommend to my friends and people I talk to. Is just make it easy for them, but also don't be afraid to ask either, because as a small business, people want to support you, right? They want to feel proud that they can help you out. So one of the best ways of doing that is by leaving a review, which is great because when someone looks up, Austin Pharmacy or pharmacy near me, they can go to the box chain store that has 50 one-star reviews, or they can go to local pharmacy with 300 5-star reviews, right? So
yeah, it matters.
A nice thing to have. So I've been working a lot on a lot of those kind of campaigns, and using Pioneer too, sending out text campaigns and things to just re-engage with people that have gotten vaccines with us, using the mass action ad for like the care goals with the notification. So
Right.
that's been super helpful.
Nice. Speaking of, let's stay, I'll linger on vaccine season a little bit. I know everyone, that's kind of forefront of everybody in the industry at the moment. What are you guys seeing? What are you guys doing different this year, or continuation of the same that you feel like's working? Just spend a little bit of time, if you can, on just kind of like that broadly.
Yeah, I think the biggest one, and I always compare like COVID seasons, kind of like the game Hungry Hungry Hippos. Like there's like a finite amount of people that are still engaged and want these services. And so I think a lot of pharmacies, chains, independents included, are kind of fighting for that same population. Like I think the people that want a COVID vaccine or a flu shot kind of are the people that want a COVID vaccine or a flu shot.
Right.
And so really the goal is access, communication, and ease of like kind of a frictionless experience.
Sure.
And so that's really why I've spent a lot of time on the email campaign. It's because those are all the people that are engaged. We have people that come to our store just to get a COVID and flu shot because it was an easy experience. They booked online. They knew what to expect. And, we have people that drive 30 to 40 minutes just to get their vaccine because they know we have it. I email them when it's ready. They can book online. We're open 7 days a week, nights, weekends, like all that stuff. So I think we've really built like this kind of subculture within Austin that, they literally come to us like twice a year, and that's to get a flu shot and a COVID shot or a booster. And so really engaging your current and past customers. And that's why I'm really going to use the Pioneer like search fields too. Like I want to go back and probably halfway through the season or something like that, or probably even maybe by October, I'm going to find all those people that haven't already gotten their shot from us and just send them a text saying, hey, we have it, like, here you go. Because those are people that came to us in the past. So they'd probably be more willing to come to us in the future. And again, just knowing that we're not going to grab like an extra, like million people that are wanting the COVID shot. You kind of have these gaps of people that are like the eager folks that want to get it right away.
Yep.
So you want to capture them because they probably want it no matter, they're not loyal to anyone. They just want the shot as soon as possible.
Yep.
Then you have those people that are like, I'm going to get it, but I'm just busy, and see how you re-engage them. And then you have some of those people that just forget. And so how do you kind of remind them, be top of mind, and stuff like that too. So I have even just like a really basic low cost Facebook ad running until the end of October. Just reminding people we have flu and COVID shots, click to book now. And
cool.
I think my ROI on that is if we do like one COVID shot, it pays for like the day. So like of advertising on Facebook. So I'm like, I could wrap my head around that. I think we could probably get one shot, if not a little bit more, from just having that running until October, So
and the nice thing there too, it's like it's ad space, sure, and some use the link and some don't, and so some people are like, oh yeah, and then they'll pencil it in Saturday to be like, I'll just show up and see if they've got something, so maybe they live close by or something like that. But that makes total sense.
That's kind of like the big thing from the shop perspective is just trying to like engage with your patients, your customers. You might grab some new ones, but the main thing is just to, if they're out there and they've been with you before, how do you capture that? And then also like with all of our vaccine clinics, my pharmacist Ellie is, again, the most organized person I know. And so she does a great job with, onboarding new clinics, following up the old ones. And so, she actually just won like the bid for a whole entire school district. So we've been doing all of those. And
wow.
So just kind of continue to expand our vaccines with your current patients, but also the recurring business like your clinics and things like that too. So we have a lot of different options.
What's a little bit of the strategy with more of the clinics? So I heard it sounds like also the clinics are probably in your mailing list too, a little bit of when you're pushing that out. But I'm sure it's a little bit of a different conversation from some of the vaccine clinics you guys do. I know y'all do a bunch of those too.
And again, it's really just internet engagement. I feel like we have accessibility. So when someone looks up just mobile vaccine clinic Austin, vaccine clinic, flu shot clinic Austin, again, I think we're like number 5 or 6 on Google. And then when you click on it, it's really easy for you to submit a request. So you can type in your business name, how many people you have, some dates, what vaccines you want. And so we just make it as easy as possible. After that, Ellie reaches out. We have, templates of like FAQs, the time we operate, run test claims to make sure insurance works. And so again, just trying to make it as easy as possible. And then just having good relationships with, again, the HR people are key. So And that's what's crazy too. We have clinics that we've taken care of for like, 8 to 9 years. And if that HR person changes, it's like, really hard, or you still have to scramble to try to find that new point of contact.
Yeah.
Or like we had a clinic that was taking care of for a long time that re-engaged with us because they had a new HR, and they just randomly looked up and said, "Hey, can we get a flu shot clinic?" And I was like, "Yeah, we've been doing yours for the last 9 years."
Yeah, we've done this every year.
It's just because there's a new HR person, but it's kind of fun just to think that like just the normal process of people finding us is working. If a clinic that we've used for so long just organically found us again. But it is different. You have to be organized. You have to have a team. So, there's a few times where we're spread pretty thin between the pharmacy in-store clinics, but we have a really great team, and we have a lot of part-time immunizers and pharmacists that help us out too. So over the years, we've been able to have that kind of like seasonal team that helps get through this time, which is great.
That's nice. So I guess like broadly, a little bit of, I'm going to like make you talk a little bit about where you kind of see things growing and where things are going when we're all chasing the puck. Yeah. I've heard you talk a lot about preventative wellness in general. Could you spend a little bit of time on that in that space? Because I know it's obviously immunizations are part of that, but I just wanted to hear your thoughts on it.
Oh man, yeah, that's huge. And so like, yeah, I have a big smile on my face just because it's like preventive medicine is huge and something we spend a lot of time on as well. So yeah, in addition to all the things that are happening as well, one of the big things that we're working on is remote patient monitoring, a lot of preventative services, specifically geared around medical billing.
Okay.
And so a lot of times when people talk about medical billing, they, the basic introduction to medical billing people have is billing Medicare Part B with the vaccines, but this is, true down home billing your medical insurance for, like actually doing the service, right? Our clinical abilities and our clinical interactions that we have with our patients, and how do we submit that to medical insurance and get reimbursed? And so that's something we've been really pushing and trying to grow.
Okay. So you said remote patient monitoring. I think a lot of people have heard the term, but can you like give us a little bit of an overview of what, like how you approach that service, what your like touch points with the patients, like even how you staff it and integrate it like a little bit?
Yeah. And I have to give a shout out to Josh Howland, because he was the one that even got me focused on RPM, because he, I think I was going to, I can't remember which trade show it was, but he wanted me to go check out a vendor, just because I think they were talking about trying to integrate with Pioneer. So, and it was an RPM platform. So I went, talked to the CEO, learned a lot about RPM there, but RPM, or remote patient monitoring, also known as remote physiological monitoring, it's basically where you have some sort of medical device that can collect patient vitals. So that could be a blood pressure machine, a pulse oximeter, even blood glucose, or a scale. And what that does is these scales are what they call connected devices. And so some of them connect through your phone. The ones that we use are cellular. So a patient doesn't even have to try to integrate an app. You just literally use the blood pressure machine, and it's like a cell phone in a blood pressure machine that just beams the data right to our platform. Wow. And what that does is it allows you to monitor and track a patient's vitals. And then actually CMS and most medical insurances reimburse a CPT code or medical billing code for remote patient monitoring. And so they pay you for having the patient get at least 16 days of readings in a month. You also have to work them up for about 20 minutes, which could be just monitoring their values, making a summary, touching base with them. And you have to call them at least once a month. And that reimbursement, I mean, it's anywhere from $50 for the readings, and then about $50 for the analysis. And so it's about $100 total for the whole thing, which is great. So that's, again, a really good recurring revenue that's great for the patients. And we've had a lot of success. So that I'll talk about some stories that has happened with it, but that's RPM in a nutshell. But it's been really fun, and our patients have really, really enjoyed it.
So is that like you're looking at, I'm just going to go with like a certain patient population in your pharmacy. Is that where you kind of started with that, to be like, hey, look, here's who qualifies. I'm assuming there's some qualifications or some parameters around a patient that qualifies for the service. itself, and then they're just integrating it into like MedSync, or is that through a different process altogether?
Yeah, for sure. And so at first you can kind of look at it a couple different ways, right? So when you think about remote patient monitoring, again, there's a lot of different devices you can utilize for the tracking. But, like I've heard of all these like horror stories with RPM in the sense that like people are doing it for the money grab and not doing it for the actual benefit of the patient. So I've even heard of a physical therapy group giving you a little pedometer and trying to say that's remote patient monitoring,
Like a step counter? Like,
yeah, exactly. And,
sorry,
then they were trying to say that they were tracking falls.
What?
Because if the pedometer stopped working, then something might be wrong.
I guess.
But I'll be honest, it was a mess. The nursing home that they implemented it at, they said it was a nightmare.
There's no way.
So I do think there's a lot of bad actors in the space just seeing this as a money grab. One of my pharmacists actually, when he went to his visit, they said, here's a scale, take it and use it. And it's because they were trying to build that code, again, not for any value for the patient, but just because they were like, wow, if Mark steps on a scale 16 times a month, I can $50.
Right.
So there are some bad actors with it. So the big thing that we wanted to focus on was like, what is going to be the most value to not only the patient, but to a provider? Because we really want to help like support physicians and nurse practitioners. And the one that and I say we, but we work with a preventive medicine physician who designed all of our protocols.
Right.
And she's also the one that has all the medical contracts that we bill under as well. But our team over here and our staff kind of help with patient engagement and training. And then she handles all the clinical sides. And so she basically said that blood pressure is the number one thing that you can monitor to help prevent hospitalization.
Okay.
Patient, adverse reactions, and all the things, right? Because you can monitor, heart failure, high blood pressure, preeclampsia with pregnancy. You can look at all these different things, or you can even look at pain management. As someone's pain levels go up, their blood pressure actually increases too. So I'll tell you a story a little bit later about a patient who we actually were able to identify when her pain management was starting to get out of hand because her blood pressure, which was usually solid, started increasing. And we, worked with her pain management doctor to just tweak her schedule a little bit more and got her blood pressure to come back down, which is, again, something I didn't even think about. And so long story to your question was we originally just started looking at which patients had either high blood pressure or different things. But ultimately, the thing that we realized is the most important are you need to find patients that are engaged and people that actually want to be a part of their health, right? So even if someone is almost like, in hypertensive emergency, they're uncontrolled blood pressure, they have heart failure, if they don't want to just put a blood pressure cuff on and press a button, they're not right for the, for the service.
Yeah.
So one thing that I found through this whole process was you have to find the right patient. And if you don't have the right patient, like I had a longtime patient of ours who his wife was really engaged and he wasn't. And he was like, I'm not going to do this, Rannon. And I was like, that's fine. You don't have to. He's like, no, I'll try it. 0 readings, Mark. Zero readings in like 3 months. Finally, I just called him and I said, hey, can you just bring your blood pressure machine back? We tried it. It's all good. So, but his wife is great. Model patient. It's great. We're helping her out a lot. But that's one thing that even more so than which condition, it's the people that want to get better and want to practice. And so what I really found was even more than targeting is just having a sign up in the pharmacy saying, hey, get a free blood pressure device. We'll monitor, we'll help send summaries to your physician. And that's a big thing too, is like the physicians need help, right? They don't want a bunch of like chicken scratch, like blood pressure readings.
Sure.
We provide them with your monthly average, your high, your low, what your average reading was compared to last year or last month. And so there's a lot of data that in a really quick 10-minute visit, a physician can get this and make a data-driven decision to say, you know what, I was going to increase your blood pressure medicine, but it looks like you're doing fine. Oh, and we also, because we have all the filling data, we actually provide like patient went out of town, forgot their blood pressure medicine for a month.
Got it. And so that's why you see the spike or something like
that. Exactly. So we're really trying to do that and kind of engage with providers too, which has been also difficult. We've been doing a lot of physician like lunch visits and marketing and hasn't really amounted to much because, again, if that physician's not motivated or not recommending to their patients, that's why we really are just trying to focus on people and patients that want to get better and want to track this. And so
Yeah.
it's been a learning process for sure.
Yeah, so you're probably like targeting sounds like a bad word, but like you're really like trying to look for the folks who would like really, to me, benefit for the service or the post that's probably already kind of tracking it maybe or something like that. Who's always like, oh yeah, I have one of those or something like that. Like it makes total sense. Like that's where to start with that, because that's how you get one consistent data, but also to help the person that can be helped from that perspective as well.
Yeah. I think so too. And that's kind of like the kind of disappointing part too. It's like they always say that you can lead a horse to water, and it's the same kind of thing in healthcare, right? Like, I feel like as pharmacists or healthcare professionals, you can only do so much as the patient's motivated, right? Like we can fill your medication, but we can't make you take it.
Yeah.
You can go to the doctor, but if you don't listen to their advice, nothing happens. And same kind of thing here. So it's definitely been a learning curve in how to market and target, and we're still trying to figure that out. But ultimately, I think the biggest thing that I found, which is beneficial, is that relationship. If I have a patient in mind that I'm thinking of that would be great for this, I think I have like 100% like success rate of like just saying, hey, Mark, we started something new, and you're the first person I thought of because you would be great for this. It's going to help you out. We'll be in contact, and I think it would provide a lot of value to you. Like here's some more info about it. And then all the people that I've talked to, especially in the beginning where I started doing the pilot, they were just like, hey, Mark, if that's what you think, I should do this, I'm here for it. So I think that's where we can also utilize that rapport we have with patients to, again, provide value and kind of help loop people into new services that we offer.
So you're probably, and you're probably just making like, I don't know, like you're speeding up the patient's progress to me too. Like, you're amplifying whatever that you would call that, right? But like probably not giving it great words, but like you're probably just speeding up whatever progress their journey are on. You're just like, oh, now I got this other like whole ecosystem around me helping me get to wherever I'm trying to get to, whether it's like keep my blood pressure down or your A1C. You said glucose monitoring too. Maybe you got a CGM or something like that. That's part of that. I'm going to say it's very on brand of you to say, oh, we've already got cellular devices, so they don't have to do anything. Like you talked about frictionless before. It was just very on brand of you to be like, yeah, I don't want them to have to try to connect their phone. I don't like.
Yeah, it's like, and that's the thing that's so funny is like, I do think it's changing. And so, I talked to a lot of my friends about we've done online booking for our vaccines since COVID, which has been awesome. It's been really, really good. But the biggest pushback I get from even some of my really close friends that like I try to help them out as much as I can, but they're just like, oh, our patients, they don't know how to do that, or they don't want to do that. Yeah. Which I totally get. But as they get older and as time goes on, they are more and more, these older patients are more and more technology literate, which is great. And my thought though too is like, even if 30% of your patients do it online, that saves you so much time from the paper. And then it becomes 40% and 50%. And that's one thing that we talked to you about. So Dr. Watson is our protocol physician. And so she actually learned about this in medical school and residency. And they talked about RPM, but they basically said the technology isn't there yet, but we can see that this could be something in the future if technology gets better. So once we found out about RPM, and I talked to Dr. Watson about this, and I said, actually, they have cellular devices. And then that's when this all kind of started. And she was really excited because she said, okay, I can believe that a 70-year-old patient can just press a button like every day. Like I can do that.
Yeah.
Perfect.
Yeah.
Actually, we have, I think our oldest patient on RPM right now is 99. And at first we were a little hesitant because we're like, I don't know, like, will that be really helpful? But she is on it. She takes it every day. She met with us. She's so with it, like mentally. And yeah, she loves it. And the fact that a 99-year-old patient can be using a cellular blood pressure device and we're monitoring her values, daily for the last, what it's been like 10 months since she's been on. Like,
okay,
that's crazy to me. And so technology is really growing with that. So again, a lot of the times we talk about processes or things, it has to be, like you said, frictionless. It has to be a great experience. And that's one thing that I do with my students every time they come through is I'm like, hey, go through our website, try to book a vaccine. Tell me how it is. And if it's just really hard and they tell me like, this is clunky, this is not great, this isn't helpful. And so we're trying to figure out new ways to make it a little bit better too, which I'm a little guilty of because sometimes I set it and forget it. But
Yeah.
I'm trying to always think about what's that process like and how we can make it better.
Yeah. No, that was that's good. It was like, oh man, like so I don't even have to like connect anything to Wi-Fi. They don't have to connect anything. Like it's just like that's a game changer for like trying to do that at any scale and not have to be tech support as much as possible. For that, the last thing you want is a month to go by and you didn't get any readings because of something failed in some way.
That's right. That's right. And that's something you talked about, like, or one question you asked too, I'll get back to is like, how do we kind of fit it in workflow and what does that look like? And I think that's probably the biggest thing of like medical billing in general or medical services. It's all about how we can utilize what we already have and kind of build that in, right? And so right now, we're lucky here just because we have the team to do it. So I have a pharmacy technician who actually started as a COVID tester for us. And so we hired her on full time to basically run our testing department, but also she's a tech. So she helps with data entry and she had some extra capability to take on some more projects. And she's awesome. She's so detail oriented. She loves learning about the process. And so she's handling, the majority of our remote patient monitoring now, of checking on people's like values and writing the summaries. And so it's great because she's not only able to do that, but also during the flu season, she's typing, thousands of shots.
Yeah.
She's running our testing department throughout the year. And so it's something that is nice, especially for those pharmacies that aren't really ready to fully develop. Like I have a friend up in Paris, Texas, who literally hired a nurse just to do her RPM. And again, that's awesome. Though sometimes people might want to, dip your feet in it first, kind of see how it works. Aren't really willing to kind of fully develop that much payroll. So there's ways you can kind of do it. And in addition, one thing too, with just like medical billing as well is like there's a lot of overlap with a lot of stuff we do, and we can talk about later. But especially within the pharmacy for RPM, there's a lot of different opportunities, and that's something that we're trying to do now. Mark is like, we're really grateful that we have a great physician relationship to set this up, but that's always the hardest part of it. And so we're trying to figure out how do we, and just so y'all know too, like we actually created our own like physician clinic, basically that has all of these like contracts. And so what we're trying to do is we're trying to figure out how can we use that clinic and an engaged provider and offer that to other pharmacies in Texas and maybe, outside of the state eventually. But, I don't know. And I'm still trying to figure this out in my brain, but like, whether it be a pharmacy that wants to get into these services, but they just don't have that physician that can partner with us, or, eventually like this physician clinic that we have, we're going to have enough staff where, hey, if you can refer us a patient, like, we'll do all the work and then just do some sort of like rev share. So we're trying to figure out what that is. But the main thing that we always found is that it's really hard for pharmacies to kind of get in that and have that relationship, which, some people, I know Amina has great relationships with their physicians and some other folks too, but like, that can be a challenge, I think, for a lot of pharmacies,
right?
Us included, for a long time.
Yeah. Is that a, I guess like we were just at, we got invited because someone knows us. I guess one of these physicians has a spouse that is a pharmacist as well. Well, something like that, right? Like, so it's a small world in this, and just even in Texas in general. But we just went to a conference for just like allergists, and they were like, we really want you there. We're like, okay, I mean, we'll go. And then we had a couple people who were like, yeah, we're opening a pharmacy, or we're partnering with a pharmacy for this or XYZ. So it was a interesting place to be, because we're not normally at a place like that at all, really. But I was just trying to think through, like, is that like some type of consortium or something like that? You kind of like try to like figure out, where you can get a lot of them in one place and figure out like where, who, and what type of person would be kind of into something like, and I'm talking about from a physician partner perspective. It is trying to do something like that instead of trying to knock door to door.
Right. Yeah, exactly. Well, and that was interesting too. So like, what was like, kind of from your perspective, what was that like? Was there like, opportunities for you there?
Yeah, we came out with a couple. Any trade show for us, like if you can come back with a handful of opportunities, great. Usually about one or two, if you have about five, work out for us. There are folks like partnering, like building out pharmacies with other pharmacists that happen to be there that are trying to do something more specialized for like that space they're in, which was like the allergy world. So I guess there's some specialty drugs or something like that, and there's some people are popping up doing, but so short answer, yes, it was actually surprising to even like. We did this as someone I know, and we're like, yeah, cool, we'll be there and show support, and turned out to be better than I ever thought. Even though, I know that doesn't sound like a lot, but I don't know. I was trying to think through like how do you get in front of a bunch of providers all at once and still have like individual conversations to like understand like what you're really trying to do and how it doesn't compete with what you're doing and it only enhances what you're doing, right? Like that's kind of the some of the, I'm sure, aspects of what you're talking about with them. And so it's like, man, instead of going door to door, how maybe they can let you in the door at one of those and just
for sure
have a booth and go, hey, look, this is what we're trying to do.
Yeah, I definitely think marketing is like a big piece of that, and that's why I'm still trying to learn. So I need to pick your brain more about it, Mark. I don't know. It was one of those things where it was just surprising, and I was like, oh well, there's places you can get in front of a lot of physicians, I guess, in Texas probably. What's the biggest difference that you saw between physicians? Because you normally talk to a bunch of pharmacists, pharmacy owners, techs. What was the difference you saw between physicians and pharmacists?
For the most part, it was there's just an element of like, I just want to go spend time with patients. If whatever you can do to keep me out of dealing with whatever I have to deal with and you make it easy for my staff, then that was like half of the battle. It sounded like, even from just like other solutions, not even just Pioneer at all. Just like being there, listening to them and listening to other folks, like you talked about, almost frictionless in a way, like again, very on brand for Tarrytown and Rannon. It was just very, that was like almost priority, like filter number 1 or 2 with some of these conversations. It was obviously some things were about revenue and patient outcomes, but 2, it was like, I'm not burdening my staff with another thing. And so like, how do you position it to where it's totally not that, is what it sounded like to me.
Yeah. I can respect that for sure, especially because I feel like they're having less and less time to spend with their patients and their staff is so busy anyways. So like to have, I think just like with us too, to already ask for your technicians to do one more thing or do one extra step is like a really hard thing to kind of like.
So I know we're staying on this a little bit, but I wanted to linger for a little bit more. You've had some patient success, I'm sure. You kind of talked a little bit about it. Do you have a story or two like that, something like this has resulted in something super good for the patient and the provider too?
Yeah. So probably I think it was like our first patient, I think our first or second patient that we got on as our kind of like beta test or like our focus group. But he's a physician, and when he started with us, he was ER physician, really high stress, all that stuff, right? Yeah. And so he was on blood pressure, he was well controlled, and he's very health conscious. Reads a lot about just functional medicine and longevity and all that stuff. And so we started tracking him. His blood pressure was rock solid, right in range. And then literally 2 months in, he retired. And what happened was, as soon as he retired, his stress level went down, right? So he's not in the ER, he's not scrambling.
Right, yeah.
His blood pressure started tanking, and because he was over medicated. So when he was a working ER physician, he needed that blood pressure medicine because his stress levels were so high, he needed to get it back down into range. But when he retired, he didn't have that stressor, his blood pressure went down, and he started getting actually symptoms of hypotension. So he was starting to get dizzy, just wasn't feeling well. And because we were able to see that trend, we called him up, showed the results to his doctor who, we worked with his doctor for a long time. And so super smart guy, really database, instantly recognized the issue. I think cut his dose in half, and then boom, his blood pressure was back. And so
good. Yep.
that was like, I think month 2 or 3 of us doing this. And we were like high-fiving each other because we were like, man, this is like awesome. Like we're helping so many people. And that was something that was really great. Because I never thought of, again, when you think about these kind of services, you think about people that already have high blood pressure or are uncontrolled. But imagine him, right? Imagine that patient, if he wasn't as engaged with his health, said, no, Mark, I'm okay. I don't need blood pressure. My blood pressure is fine, which it was.
Right.
But that's why it was a good reminder for us, where now you kind of ask who's the ideal patient. I'm kind of saying everybody, as long as someone's motivated enough to take their blood pressure
Right.
or take their, lab value, it's really the best thing for them, because even if you're normal now, it can start creeping up. And we even had, I guess, another few success stories where people that were kind of in denial. So we had one of our pharmacists was really worried about her parents and was like, I'm going to get them signed up so I can track it. And her dad was almost, having to go to like hospital level, like blood pressures, like every other day, and was in complete denial. Mark was like, my blood pressure is fine. It's normal. Like, I take it on this blood pressure device and it says I'm fine. Yours is wrong. It's broken. But that device he had was like 15 years old, right? So I'm sure the sensor was like worn out.
Yeah.
So literally, I mean, we switched out his blood pressure monitor like 3 times before he finally was like, oh, maybe it's not the blood pressure machine. Maybe it is.
Yeah, maybe it's the ancient thing you've been using the entire time.
Exactly.
Right,
But that's the thing that I think is so interesting, where I think, again, it's a scary thing too, where it's like, I do the same thing too, right? Like, I had my cholesterol checked, I don't know how many years ago. It's probably still fine. Like, but it's different, right? And it's actually kind of depressing. I got my lab work back, and I think my cholesterol is getting too high, and
Rannon,
yeah, high too. It's sad, Mark.
Yeah, I got chewed. I think I already said this on the last podcast. I had my annual butt chewing from my doctor a couple of weeks ago.
Yeah. So now I'm trying to cut out sugar and all that stuff.
Trying to eat salmon.
Right,
Freaking
exactly.
salmon.
I'm the same way, man. So, but it's one of those things where it's like, I think it's an easy thing for us, like for our patients, but for us too, to just say, I have been okay, which means I should be okay now.
Yeah. Well, that's so. I was going to stay on the. Sorry, we kind of lost the tangent there with the patient. So they finally are like, okay, cool. We've swapped out 3 things. Maybe mine's bad. What was the next thing after that? They started kind of actually adhering, or?
Yeah. And so, I mean, and this patient, is like a former engineer. He used to keep his blood pressure logs really organized. But after that, it was just having a conversation with him, his doctor, and then, just finally getting on a blood pressure med. So I think so he started blood pressure medication, but I mean, I think he was on our RPM service for like 4.5 months with like consistently high, like, to the point where like our physician, Dr. Watson, had to send him a letter to say, listen, like
hey, dude,
I don't know what you think, but like you need some like therapy. And she even wrote a message to his doctor too. And so it took a lot of coaching and stuff too. But again, I think that's what I always tell with people, where it's like, like one reading can be a fluke. A few readings could be like maybe a trend. But I mean, if you have 6 months of data that you're consistently high, right? Like that, it's hard to kind of refute that. And it's not like we're trying to shove it in the patient's face or anything, but it really is just trying to show them value, right? Like if you go to your doctor, take one blood pressure reading and it's high, I would argue that, hey, that may not be your blood pressure, right?
Right.
If you take a week's worth, okay, like that might be fine. Or like your blood sugar, right? Like, like my family has like 7 birthdays within like a 9-day span in December. So like, am I diabetic? Probably not. But did I just like eat cake for 10 days? Yeah, probably.
Right. Yeah, there's a spike that week. Yeah,
exactly. So I think it's one of those things where when you have that length of data, I mean, it's going to be so valuable in the future. And that's what's so funny too, is like these new Apple Watches and Fitbits and these like smart wearables, like eventually when they get that FDA approval, I mean, theoretically, every person with an Apple Watch could theoretically just be on RPM, like with just putting your watch on. It's kind of crazy. So I do think that there's more opportunity for that, and I think pharmacies are well positioned. One, because we have access to the medical or the filling history, because I think that's really important as well. Because again, is your blood pressure high because it's out of control, or is your blood pressure high because you just are, non-compliant non-adherent. And when we call you for MedSync, you say you have enough meds, but that's been like last 7 months, right? So
right.
I think there's a lot of value that we could have with kind of communicating with physicians, nurse practitioners, and pharmacies. And so we need to definitely utilize that. And I think there's, like you said too, there's a lot of interest within the medical profession for that kind of collaboration, which I think we can capitalize on.
And like you would think, at scale, payers paying for. I mean, I know they're paying for our RPM, but that you made two great cases on like why payers should pay for that. Otherwise, the guy with the super high, you just prevented probably some type of like emergency room visit on in both cases, right? Like
100%.
So you just saved the system a crap load of money. By just doing the right thing, really, for the patient.
And I'll give you one other use case, Mark, because this is something that we're trying to reach out to different health plans as well. So we reached out to a newer health plan, and we kind of told them about RPM and what we can do. And what was interesting is that we said, hey, blood pressure, blood glucose, weight loss. And they said, whoa, weight loss, tell me more about that.
Okay.
And I was interested about that. So they're a young health plan, right? And so brand names are their biggest spend. And the most popular brand name out there are those injectable weight loss drugs.
Yep, we know them all.
Exactly. So this health plan basically said that they're having a really tough time with prior authorizations because physicians and not just physicians, but when they're receiving prescriptions, people are lying about diagnosis codes. They're saying, Mr. Jones has diabetes.
I've got sleep apnea. Yes.
Right, exactly.
And diabetes. So yeah.
Exactly. Yeah. Or there's this funny skit about, if someone was getting prescribed like medical marijuana and like, just give me any sort of ailment or whatever. But it was crazy. So they were interested in the scale because they were saying, hey, if we can basically make a contingent PA, and I don't know about if this is even legal or not, but they were just thinking, if we can say, hey, Mark, like we will approve your injectable weight loss drug, but we're going to give you the scale, you're going to weigh yourself, and if you don't qualify for the FDA requirements for needing a weight loss drug, we're not going to approve it. And if you're losing weight, which is the goal, and as soon as you cross over and now you're in range, we'll stop paying for it. Because again, that can't support weight loss forever. It has to just get you in range and you have to have lifestyle modification. And the flip side to that too is if we give you a scale and you're not losing weight, we're going to stop paying for it as well because it's not working. So for them, they're thinking of it again as a health cost, being like, all right, we want to help the people that truly need it. We want to prevent people that are using it just because they want to, be skinnier for as long as they're using it. But then also, if they're using it and they're not getting better, we need to try something else. And so I thought it was an interesting view because I had never thought of that from a prior authorization thing. Because right now, your only answer is to either just approve all of them or deny
all of them. Because they all kind of say the same thing in a way.
Right, exactly. And as a young health plan, you're going to go bankrupt if you just keep
all day
making it rain with GLP-1s, So I think it's interesting. And so we're kind of in convo with them, but like I said, I don't know if it'll actually work out, but I just thought it was an interesting proposition because again, these health plans, like you said, they need to find value because what's working isn't working. There's a problem with hospitalization. There's a problem with, weight, obesity, chronic conditions that it's only getting worse. And some of these health plans are going to be kind of really, really looking for some opportunities to do some preventive medicine.
Yeah, that makes a ton of sense. Because otherwise, it's almost opting into, yes, okay, from the data, it looks like, yes, you qualify too. Here's your contingent PA. Yes, you're going to do it, but here's the program. And the program is you're going to be on an RPM type setup for while the life of you're doing it. And that way we can understand, is it being effective? Is it not? And that makes a ton of sense, actually, that approach. But yeah, I give it. But the one thing I'll commend you for it, whether that happens, whether that comes to fruition or not, you're always doing something different. You're always you're always trying to I don't know, be your own compounding pharmacist in a way within your own business too, right? And be like, hey, how can I help other people or other stakeholders all the time? So this is just a credit to you and your staff. I know your staff is 100% of how you're powered to do some of that stuff, that you're able to do that. But again, credit to you for just being out there and going, I think I can help. Right. Yeah.
I appreciate that. And that's kind of what I try to talk to, especially my students about too, is there's a lot of problems out there that don't have solutions. And, there's two ways of looking at that, right? One being oh, well, there's no way to do that. And the other way is like, oh, like there's no way to do that. So we can kind of figure it out. And I feel like a lot of pharmacies and pharmacy owners, we're kind of like the latter, right? Like we're pretty much like, I always tell people like pharmacists are professional problem solvers, but questions are kind of medication related. And so we're just trying to find ways to help our patients and do the most that we can. And especially in this new wave of like just medical, because then there's other medical billing opportunities that here in Texas that we're trying to take advantage of, even just with immunizations, they're like every time. Okay, so my
what are those?
So my big thing with medical billing is, let's say right now you have the pharmacy way and the physician way. So when you go to the pharmacy, traditionally you get your shot and you basically bill the insurance, the prescription insurance, for the cost of the medication and an administration fee, right? You usually get paid for the cost of the shot and a little bit of money for what you kind of put in to administer it. On the physician side, you're going to go in and they're going to do the same thing. You're going to get a vaccine. They're going to bill your medical insurance for the cost of the shot, the administration, but they'll also bill for an office visit, right? And there's nothing special about that office visit, right? You go, the MA will take your weight, might take a blood pressure, ask how you're feeling, like, ask about any allergies or changes, and then most of the times the doctor, actually I can guarantee you the physician's not giving that shot. It's an LVN or an MA.
I've never had, anytime I've been in there, no. Not once.
Exactly. But they're still billing for that as well. And so that's one thing that when I think about, hey, how do we do vaccines here in the pharmacy? Well, our pharmacists are checking interactions and past medical history and contraindications, and we're talking to the patient about how they're feeling and any reactions that they've had, and they're going over any side effects and the process for what you do after the vaccine, and we're monitoring them. That's an office visit. And so that's one thing that we're working on, and a lot of pharmacies. I'm on a chat group with a bunch of pharmacies in Texas that are working on medical billing, and we can submit as a pharmacy, even without our physician, as Tarrytown Pharmacy, Mark Bivins Pharmacy, you can submit a claim to the medical insurance, and we're not going to be in network, right? I've been trying for 8 years to be in network as a pharmacy. It probably won't happen for a while, but you can still bill their insurance, and if it's out of network and they have out of network coverage, you'll get paid for that, right? And sometimes it's a deductible, sometimes it's a co-insurance, sometimes it's a copay, but a lot of times like you can get reimbursed and go from there as well. So it's kind of nice to again start exploring that space. And again, it's when you talk about staff and utilization, that's stuff we're already doing.
Right.
But like if a physician was doing that and wasn't billing for an office visit, or imagine if a pharmacy didn't bill for the cost of the shot, it just seems like so like basic, where it's like, yeah, of course, like they're here. And there's actually a code, it's a 99212, I think, which is a 5 to 10 minute office visit. Well, what's a vaccine, man? It's a 5 to 10 minute office visit.
It's 100% what that is. And you're exactly right. You go through the question set, you go through all of it. It's like I've probably had at times, no offense, no offense to my doctors, but at times in some of the pharmacy visits I've had when I'm doing some of those things, I have more in-depth conversations there than I've had at certain, I don't know, any other physicians that I've been to in general. Not all of them, but most of my visits in that way. Yeah, 100%.
Yeah, and I think it's just like a change of mindset too. My joke has always been like, there's like a CPT code for everything. And so like when you go to your physician's office, they're probably building a code for like opening the door, but that's great. That's how a physician has always had to think, where it's like, and that's why you have like the medical billers and the medical coders, right? One of them just, hey, tell me what to input, I'll input it. So one of them is just a data enterer, but one actually will interpret, hey, Mark put in these notes, so what can I bill for? Oh, look, you did a depression screening. Oh, they did this. And literally you're trying to extract what interactions you had and how do you bill for them. And I think as pharmacists, I think if we hired like a medical biller or a medical coder to just sit and listen to all the things that pharmacists do, they would probably have a laundry list of like CPT codes that they would bill. And actually that's probably something I should do. I should probably just like hire someone saying, and be like, all right, listen to what the pharmacist is doing and pull every CPT code that we could bill for if at like if we were in a physician's office, right? I bet you it'd be so long. Because think about like those 20-minute counseling phone calls that we're on, which again, can't say that. So this is my big spiel to like pharmacies. You cannot medically bill for counseling. Don't do it. That's going to be like the number one way for us to get booted for life.
Right.
Because counseling just sounds scary, because when you hear counseling, you just say, hey, Mark, take this with food. That's not, you can't bill for that, right?
Right.
But consultations you can, right? So a phone conversation with your physician, you better believe they're billing a 99441, which is a telephonic consultation. And same kind of thing as well for us. It's like, if a pharmacist is actually on the phone looking at drug interactions and talking with a patient or going over vaccines, that's a consultation in my mind. So I think we're going to have to kind of change our verbiage a little bit to be able to match what we're actually doing. So now, for the longest time, when we counsel, it's a new med counsel, right? Like a new antibiotic. But when my pharmacist spends longer than like, a minute with a patient, we need to start calling those consultation, because that's what it is. It's a consultation without an appointment. It's just, you can literally have a consultation with a pharmacist whenever you want by calling your local, independent pharmacy. So I think that's number one, is just changing your verbiage. And then when you're starting to bill, we're actually billing for what a physician or a nurse practitioner would as well. And we have to start thinking that way.
All right. Damn. That is awesome. Okay. Well, how do I get in this? How do people get in this group? Okay. No. But really, like usually after this, there's going to be people that probably listen to this and go, man, I need to talk to Rannon. What's the best way to probably like get on your schedule? The one thing I highlighted with Jeff and almost everybody we talked to, Rannon, you're one of the most approachable, available people that I've ever met that was like, oh yeah, I just called Rannon. I was like, of course he just responded to you or whatever. So like, what's the best way to like kind of talk to you about any of this from your perspective that works with you? Does that just hit your website or something, or?
Yeah, for sure. Like, I probably need to, but when I see like Ben and Joe and everybody, they have their own website. So I probably, no, they can just email me. Either here at the pharmacy or, wherever, but, or if you're at Pioneer or a conference, I love chatting with people. But yeah, I'm always down to talk with people about pharmacies. I love pharmacy stuff, so I'm always happy to chat with people. But I think there's also just people, the more I have trying to talk with folks, I mean, there's innovative people kind of all over. And so my big thing is like, things might differ state by state. And so if you're involved with your state association, maybe that you'll know some places there. Because I know in Texas too, we actually have legislation that allows us to do some of this medical billing and not have any sort of like weird penalties and stuff too. So there are some differences within like states, but I'm happy to chat with people because I think we're going to start seeing bigger trends as time goes on that that's just going to be a need, right? Like if you're in a rural area in whatever state that you're in, that's just going to be part of it. And so I think the more pharmacists can get introduced and familiar with this, it'll be better. Like if someone snapped their fingers and we all became Medicare providers, like overnight, like 99% of pharmacists, myself included, as of only a few years ago, would not know what that means. It's like, okay, great, now what, right? And so we have to kind of familiarize ourselves and get okay, like with how to bill CPT codes and how do we understand, like documentation. And that's why the Pioneer Care Goals have been so great, where, we document all of our RPM documentation within Care Goals. And it's great too, because you can build in different templates. So it helps guide my teams around, hey, if this blood pressure was high, right click, add care goal, high blood pressure, click. And then it just says, hello, my name is Rannon. Ask patient this. And like it literally lines it out.
Gives them a script for them and
exactly,
all that. Yeah.
Exactly. So we have to start thinking more about, again, how we can make it easy for our team. And then also how do we document that as well? Because that's huge. And there's a reason why the nurses and doctors stay so late after hours documenting, because, you have to document. And if you don't document, it didn't happen. If you can't document it, you can't bill for it. So it really is important. That's why, care goals are eventually, I think it'll be awesome eventually. And I know you guys will work on it eventually, but like eventually, as you can almost log what you're doing in real time, documenting automatically. So it's like, like Rannon accessed this care goal,
right,
spent this much time, like, type this in and looked over here. And, like, I don't know, I just watched like
it's a great use of like AI too, right?
Exactly. Like I just watched
right?
like the Apple, 5-minute description of what the Apple Intelligence is going to be.
Yeah.
Like that's kind of insane. Like you can summarize emails and do all this stuff, or just like do things for you, or like, hey, organize my to-do list for today. And so I definitely think that would be really cool, is if it can log your movements within Pioneer or your system and create almost like a baseline template for documentation.
Yeah, literally, it's almost like if you train it to do. I'm over here like I'm not a product person, just FYI, everybody. but I don't want to like put Josh and the team on the hook for anything. But it's cool. I'm used to like writing checks. They got to cash at times anyway. But like almost like what you talked about with the medical biller following you around. Like if you could literally just have AI observe like everything you just did in the system itself and go, oh, hey, here's all the things that were billable events that you did. Here you go. Here's your list. So I don't know. That'd be fun.
Yeah. Or if you want to get super scary, Big Brother, Terminator, have a microphone in your patient room that basically just transcribes the interactions you have between the patient and summarizes it,
Yeah.
That would be insane.
That would be great. I'm one of these people where I'm like, everything's already listening anyway.
That's probably true.
That's just how I am. I'm like, yeah, I don't care. Like, go ahead.
Yeah.
But I know not everyone feels that way at all. Like,
Mark, I'll be honest. Like, I had this like weird, scary thought. I had what was it? I was thinking about one of my friends, and I couldn't remember what his wife's name was. And I was like, I need to catch up with blah blah blah. And what was his wife's name? And then literally, I opened up I think social media, and then her post was like, and I was like, okay, no. I know I didn't say it out loud. I was like, they're reading my thoughts now. This is insane. Like, it's out of control, Mark.
My wearable is tapped into my brain. It's happening.
Yeah, it's crazy. I don't remember signing up for Neuralink, but maybe
maybe you did, dude.
No, it's crazy.
It's the radio waves. It's the radio waves.
It is. That's right. Yeah.
All right. I don't let anybody leave now without a prescribable. So what are you watching, listening, reading to, or into that you think anybody else would be into?
Yeah. This is kind of like a random thing, and I wish I was listening to more pharmacy or businessy podcasts. But right. I've gotten really interested in like the business behind YouTube. And so there's this podcast called Colin and Samir, and there's just these two guys that have been doing YouTube, and they interview creators and they talk about just different things. And I really kind of see more about marketing, because they talk a lot about titles and thumbnails, and the first 5 or 6 seconds of your video really need to engage. And what I thought was really interesting is that basically, whether it be ESPN, TV,
sure.
Like streaming sites, everyone's vying for our attention, right? Like social media, like every single app, platform, whatever we're doing is they're monetizing attention. And so I thought it was really interesting just hearing from these different creators and different people of like how they're doing that, but then also unique in different ways to just expand and diversify too, right? Because like, I don't know, like Mark Rober is the YouTuber that does.
I love that guy. I love that guy.
Yeah, he's so cool. And it was interesting because he started doing YouTube videos just because he was bored and wanted to do something on the side. But now he's made a separate business, Crunch Labs, which is all just toys and different things that helps kids like learn how to be engineers. That he's creating like some stuff for adults. And what's interesting now is before YouTube used to be his primary kind of goal, right? And then now the YouTube channel almost is there to serve his new business, Crunch Labs.
It's the funnel to the business now, right?
Exactly.
Yeah.
So I kind of think about this kind of in the pharmacy way too, right? Where it's like, I feel like for the longest time, filling prescriptions was our YouTube channel. And then now we need to start thinking about what's our next step, right? Because if he gets bored making videos or doesn't want to do it anymore, or people stop watching, what's next, right? So it's kind of like the NFL dilemma, right? When you're not, throwing touchdown passes and, like guarding people, it's like, what are you going to do after? And so kind of thinking about what is your next step and, how many supports do you have supporting your business? So dispensing prescriptions has always been our initial kind of like bread and butter, but that's why medical billing and anything else, to be honest, like anything else that's unique, I don't care if it's like you have a deli in your
whatever it is. Yeah.
I don't really care, but we have to start thinking about what's next, right? And how can our prescriptions support that next wave of business? So that's kind of what I've been listening to, and I don't know.
What was it called again? That way we can. I'll make sure we put it in the show notes.
Yeah, it's called the Colin and Samir
Colin
show,
Samir.
or the
Got
Colin and Samir podcast. And
Got
so,
it.
yeah, it's super niche, and like I don't know if anyone will find it interesting, but they have some cool ones. Like they interview like Mr. Beast and some people, things that people might know, and Mark Rober. And,
Yeah.
but I just think it's interesting where again, there's all these people that are just planning and trying to like get our attention, and then how are they maximizing that? And so that's kind of how I've been trying to think of marketing and kind of like targeting my campaigns, whether it be like subject lines, the first 2 sentences, your email, photos. And so I've been trying to apply it, but if nothing else, it's just been interesting. And so that's what I'm listening to.
I think I watched I don't know if I didn't watch it. I listened to a podcast called Acquired.
That's cool.
And I think they did something similar on like Google and their business too. And they spend a lot of time on the YouTube business itself, which is really cool. So if you get time, that's one that.
Yeah, I was going to say, what was your podcast or what you been listening to?
Yeah. Mine. So mine's not work related at all. And it's going to be super boring for some people. So just bear with me, everyone. But there's PBS. Yes, that's a great way to start. Like something interesting. But I don't know if you watch any like Ken Burns documentaries or anything like that.
Yeah.
Anyway, his documentary, I love his stuff for the most part. He did this is probably multiple years ago. I don't know how long ago he made this, but I just recently watched the Roosevelts, and it's a documentary across like Teddy Roosevelt, and then the lead into like FDR. And then also his wife as well. So it's like Eleanor Roosevelt. The whole like journey and like how they're different families, and I guess they're just distant fifth cousins. I didn't know this. I didn't know any of that stuff, and I didn't know. I knew FDR was supposedly in a wheelchair, but I never really knew that he almost every speech he gave on TV, he was standing up. He had polio, right? And so lost the use of his legs, but he figured it out in some way of how to like, so he actually was standing at all of his stuff. So I just always thought like, cause I only remember like the very end with World War II is the only thing I was really ever taught about him. And so I was just like, oh, he was the first president and like he was in a wheelchair. Okay. But not really. He really wasn't. Like he was, but like for all of his speeches and everything else, he was standing in these steel braces and stuff all the time.
Yeah, man, that's crazy. I'm so bad at history, and that was always like my like worst subject, but I think it's so fast. I can appreciate it now. I think when I was younger, I was like,
honestly, like I think I'm in my history phase, and I don't know what's happening. I think I'll become grumpy about people on my lawn later. But I think I'm in my history phase at the moment.
Fill your bookshelf with history.
Right. So, but Rannon, you spent a ton of time with us. I learned a lot. I'm sure other people are going to be reaching out to you. But again, thank you for everything you do in the industry. I know everybody appreciates what you're doing. And just thanks for being on and give us this much time, man. Appreciate it.
Yeah, I appreciate you having me as always. And I look forward to seeing you guys soon.
All right, man. We'll see you.
All right. See ya.
Bye, everybody.